I'd like to talk about the treatment of sciatica and the sciatic nerve with the Vibroller Hex Pro here. So I'm going to actually start with things that we can do in the sitting position with the Vibroller Hex Pro. So one of the first areas that the sciatic nerve actually becomes the sciatic nerve is in the sciatic notch, which is in the buttock, or the commonly known by the piriformis muscle, which is right about there. So in the sitting position, what I'm going to have my client do here is to actually get the edge of this roller underneath the edge of his hip and deep into that spot. And so once he finds that spot, the first thing we can have him do is just really put a sustained hold right back there. And the muscles that the sciatic nerve are associated with this case are the piriformis, which is up a little higher, and then the quadratus femoris, which is a little lower. So once you roll one spot, the piriformis, which is higher, you're going to move that roller right into the back of the femur bone, which is where the quadratus femoris is. Now, with this release, there's several exercises that we can add that are very effective. And I'm going to give you those in order of difficulty. So the first one is just small hip rotation. So while the roller is getting pressure into the muscles, he's just moving his leg very comfortably in a comfortable range of motion. So this is referred to as an active release technique, whereas we're releasing the tissues while they're actually working. The second technique that we can do is a floss of the nerve itself. So in this case, what he's going to do is to engage his ankle upward into dorsiflexion and then straighten the knee and then come back down. Good. So you can do a sustained hold with the leg straight, just pumping the ankle, or you can keep the ankle up and then just bend and extend the knee, both of which will be effective for flossing this nerve in the place where it actually comes out and exits the pelvis.
I can already feel that releasing.
Nice. Now, continuing downward anatomically, the next place the sciatic nerve moves is in between the three hamstrings. So what he's going to do next with the roller is actually move it just under the sit bone, and he's going to find a good place for that. And when I say a good place for that is you want to get the roller comfortable. You don't want to be putting the nerve in pain, is that you want to find a spot where you can really feel like you'll be able to settle into this. And so with the hamstring, we have our same options that we had before, is that we could do a sit and a sustained hold, and then we can use hip rotation, or we can use the floss of the nerve. And our other option here is to start to actually move down the muscle belly. So what he can do is keep his weight on the leg and then actually start to roll the roller, looking for spots of hyperirritability, whereas that nerve's traveling the whole way down in between those hamstrings. It could be anywhere from the sit bone to the back of the knee that the tightness could be around the nerve. So what this does is it puts vibration into the hamstring muscles, and it starts to spread the space in between them, which is actually where the sciatic nerve travels down the leg. So that's more of a rolling technique. Now, the other thing he could do also, if he wanted to, was to get the roller under the hamstrings, but to put it more of in a vertical dimension, perfect. And so now what he's going to do is just move the leg a little in and out with hip AD and abduction, which will create much more of a muscle play or a perpendicular bend within the hamstring muscles. Looks like it feels good.
And can we do a little...
Kev, you want flossing there too?
Yeah, feels pretty nice. Just
Yeah.
coming up and down too.
So once you've rolled or moved the muscles perpendicularly, you can restore vertical motion, you can add the hip rotations again, or you can add the nerve flossing again. And once again, with these movements, please do it to your tolerance. Now, following the nerve, the next place the nerve will actually split, and then it's going to travel in the form of two different nerves, the peroneal nerve laterally and the tibial nerve medially into the calf. So what we want to do next is to actually get the vibroller in the center of the calf so it can address both of these. And so you'll notice that he has the roller right in the middle of the calf, which gets to the peroneal nerve laterally here, and then the tibial nerve more centrally. So the options we have here are actually multiple. The ankle joint can create several movements to help us. We can do dorsiflexion. Add a down and out and up and in angle. So what this does is challenges all the small muscles that are deep, deep around these nerves between the tibia and the fibula to move the ankle while he's using the roller with the vibration to get a nice active release around the fibers of the muscles that the nerve is actually piercing. Now from here, what he can do is actually start to work vertically up and down the calf by using his whole body and moving, and then you'll notice that he's also getting the knee involved with a little bit of bend. So the beauty of this is that this roller fits on the lateral edges of the calf to work it from the inside out, or as he was showing earlier, you can take one of the bulbs on the peanut and get that deep in the center of the calf and work a little bit deeper.
I'm just going to hold on that spot.
And then, so once you find a spot that might be a little tighter or might have a spot of hyperirritability, use the roller as you feel necessary to get the right angle and add ankle movements, add knee bending and extending, or add hip rotations, which can actually help release that muscle. So as you'll see here is we like the motion that the roller provides in terms of its vibration and where the roller can get to, and then we like to add movements that would be beneficial to help educate the system while we're loosening it up.